Good morning, everyone. Let's get together and do the morning brief. First of all, introductions. My name is Vincent. I'm the registrar on today.
Andrew, consultant. Good morning.
Grace, nurse.
Vanda, physiologist.
And Graham, radiographer.
Okay, good. We've got everyone here. We've got 2 patients on the list today. First of all, any housekeeping things that we need to address first?
Quality assurance tests are all clear and good to go.
We are running low on EBU35 guide catheters. However, as an alternative, we've got JL35 6 French guide catheters.
Okay, good. We'll bear that in mind when we make our choices later on. First patient we've got today is an elective patient. He's a 68-year-old gentleman coming for staged PCI to his RCA, following PCI to his LAD. We're going to do an FFR and assess whether this requires treatment today. The plan will be just to use a JR4 6 French diagnostic catheter via the right radial access. His hemoglobin and hemoglobin is 145 and creatinine is 88. He doesn't have any other significant past medical history. I've consented him for a diagnostic angiogram query proceed.
Do we need to prepare the leg for the patient?
No, he has a good right radial. He managed the procedure last time using the right radial, so we should be okay.
And you mentioned that he's had stents before. What stents were put in before?
He's had a synergy stent put in last time.
Why was that?
He had a hip operation that was originally planned between these 2 procedures, which has now been delayed. But I think as we've used synergy, we should continue to use
And
this.
you also mentioned that actually you were going to use a diagnostic. I think we should just go straight for a JL4 guide so we can do the pressure one.
Of course, yes. The second patient we have today is Mrs. Jones. She's a 54-year-old lady who has type 2 diabetes, hypertension, and is an ex-smoker with previous stenting in her LAD. She's stable angina, which is still persists despite medical therapy. We're going to do a right radial access. Ideally, however, it's quite a thready pulse, so we should prepare her groin. Her sugars are out of control this morning, so I've prescribed some long-acting insulin on the ward. We will make sure that it's safe before she comes down. We're going to use a diagnostic catheters, JR4 and a JL35. She again consented for a diagnostic angiogram query proceed.
What was her renal function and HP?
It hasn't been done yet. Her last one was from a couple of months ago, and they're doing it on the ward, and they'll report to us before we call for the patient. And that's everyone.
Okay, good. Anything else to report? Any problems or issues? Staffing levels okay?
As far as we're aware, yes.
Yeah, good. Okay, let's get started.
Good.
Thank you.